late 2002 and 2010, and more recently. Now, while increased apoptosis could lead to cell loss of apoptosis companies results in an increase of cancer incidence. So the JNK pathway is also involved in cancer, if you understand it, because you need to have the apoptosis and you also need to have the molecular signaling defect JNK pathway that could impair the balance between cell survival and apoptosis. So you need the cellular apoptosis and you need the cellular regeneration. And that again is a question of the timing issue, the clocks that we were talking about earlier. So the balance between apoptosis and cell survival is crucial. Now, another research in 2003 found that the JNK pathway is a genetic determinant of aging and genetic signaling JNK activity alleviates the toxic effects of reactive oxygen species. So it also helps in the regeneration process and also in the detoxification process. Statistical analysis, this is an experimental study, found that a mild but significant difference between controls and experimental subjects, whereas upregulating the JNK signaling pathway increases wound healing and downregulating it slows down the wound healing. So JNK pathway has been quite popular in this signaling process. As you can see, it's a very, very complex process. And there are growth factors, there are cytokines, there are growth factors and MMPs, and a lot of different aspects that are involved in wound healing. And I can go a little bit more in detail in the future slides. Now, collagen receptors are also very, very important. Some of them, DDR1 is not for proliferation, but DDR2 is. So there are certain parts of collagen are important and other parts of collagen are not important. That's why we say let's increase collagen. It cannot be indiscriminately increasing collagen. You need to know what aspects of this collagen you're increasing, because that's how the keloids are made. They're made of excess of collagen in the scars. So, but it's not the aspects of collagen that you want to increase. If you want to be more specific in your signaling, it's not just collagen you're increasing, certain parts, certain aspects of collagen. So this slide proposes the cellular signaling that enhances binding to DDR2 collagen receptors is its therapeutic target, aiming for accelerated wound healing. Now, other aspects, proteinases and signaling are very, very important. There are certain proteins, the matrix metalloproteinases, the gelatinase A, collagenase 3, and so on and so forth. They are quite relevant to wound healing. Connections are also very, very relevant to wound healing, and you want those signals basically decoded and also reproduced. So downregulation of connections is very important, because what we have seen is that, for example, downregulation of CX43 results in closing the wound, and also it results in reducing the negative effects of inflammation. And CX20C has been associated with hyperproliferative conditions, delaying remodeling and recovery. So this is the signals that you don't want, basically. So timing factor in the signaling arena, we observe that healing is much lower with age to correct and incorrect cell communication. So overall, of course, timing has an important aspect, contribution, and incorrect cell communications leave the body with inappropriate signal. So basically what we need the signaling within a time frame of discrete changes. Here you see a study that shows that T cells from age have discrete fluidity in the membrane. You can see the discrete fluidity in the membrane versus a normal cell. So as you can see, the communications and a lot of communications and aging go hand in hand. So it has been found that keloids involve an increased ultimately activity of pharyngeal cytokinase like TGF, IGF-1, interleukin-1 especially. So it's the timing that is very important and how the signaling is connected to this timing. So more specialized research is needed, of course, for specific signals, and timing determines the alignment, order, and appearance or disappearance of the signals, because an extended signal could be damaging, and also a signal, of course, that you don't come on time, again, you will not get the actual process completed. So there are several factors acting all together. This is a dynamic multi-process that involves a matrix of signals within a matrix of specific timers. So this is the concept of body tuning. What we do is we decode the signals and we reproduce, we introduce the signals to the body within specific times, and these signals can alternate according to a sort of a key process that takes into consideration circadian clocks of the cells. Thank you very much.
May we request Dr. Sofra to please remain on stage for the Q&A scientific forum. And also let's all welcome back our moderator, Dr. Thelma Tamayo Rojas.
Dr. Xanya, thank you very much for that very informative lecture. You know, you're such a good model of this circadian body tuning, and you truly walk the talk, right? Okay, and I know everyone here share with me the same comment. Okay, doctor, one question. If I am your patient, I would come to you and ask for this thing that you're talking about, the circadian body tuning for anti-aging. I want you to counteract the effect of time and gravity on my skin. So how exactly would you do it to me?
Oh, okay. So, well, we have developed a device. It was built in actually in Cambridge University originally. And if you apply it on the face, it's a device actually, and it gets signals that are extremely low energy, extremely low energy, like below 1 billion for the nanometer kind of thing. So, and at those levels, the ion channels can open up, and you can pass the signals through. Once you pass the signals through, then basically the body will absorb it and repair itself. Okay? So what you see, the trick is to find the signals, what signals they are. And then what's the more complicated process is how to combine the signals, because it's really a matrix, and how long the signals have to stay on and how long they have to stay off. So it's like a music, it's like a musical piece, so it's like a movie, that every scene has to be in a certain sequence, otherwise you lose the meaning of it, kind of thing. So it's presented, and what you can see, actually I have the machine upstairs in my room, because I don't leave home without it. Like they say, you can come and I can show it to you actually. It's you feel nothing, and all of a sudden your face is lifted. I'm 62 years old. I have never done anything to myself other than never lasers, never Botox, never. This gentleman knows me from before, and I always keep postulating I will never do anything else. So it's, I can, show the effect of it. I really believe in the technology. I was involved in the programming of, and it's very sophisticated, it's very complex, and it's extremely effective. We see amazing results with it.
So,
And no pain, no trauma, actually there's no sensation. If anything, it's relaxing. Most people start snoring.
so you actually use or utilize a machine?
Yes,
It's
a
the
machine.
technology.
It's a machine.
Okay.
It's a machine.
For how long would I be under this treatment?
About 15-20 minutes. The more you do it, the better it is. Actually, we had recently a case of Coco. This gentleman, well, he cut his legs because he wanted to get 3 inches taller, and there was like a big gap in his cuff here.
Mhm.
And we put the technology on, and you could start seeing the bones start kind of moving.
Oh, magic. It's kind of magic.
It's amazing,
Really amazing.
So it's new. It's most people don't understand it. I'm sure I bored you with my lecture. It's with all of my quantum physics craziness, but it's extremely interesting. And basically, the results are very, very powerful. Very powerful results.
Would that be the same technology that you would use for chronic inflammation, like the arthritis?
That's right.
What else? Obesity, cancer, a lot more. So,
Well, we have not used it for cancer. I used it for my dog. My dog has cancer. She's still alive. She was supposed to die 3 months ago. But cancer is a very complicated concept. I don't want to say anything like that. Now, we've seen great results with wounds.
okay.
We've seen fantastic results with pain. We've seen some hair growth. Of course, rejuvenation results we see quite
We
fast.
guarantee results for pain and wound healing, right?
Healing is,
And of course,
quite
anti-aging.
relevant. Anti-aging, yes. Because if the body is healthy on the inside, you say, the aging will not be there. It's a thing we age because the body starts breaking down.
Okay, one last question. If I am the subject and I come to you for anti-aging regimen, how long would I get the benefits that I desire?
The results are permanent. Of course, you will continue to age. It's not going to stop you from aging. But the results are permanent in the sense that they don't go back to what it was before. You may need more than one treatment if you're...
Just one treatment, I get
With one
results.
treatment, you can get results
Oh.
immediately, yes.
Well, that is
They might not last as long as if you did 3-4 treatments, because then your result is stabilized.
The more you
there
get
is a
better
difference.
results.
Yeah, the more you do, the better results you get, obviously. But it's not, you see very, very fast results, obvious results, they're dramatic and they're long-lasting.
This sounded so good. And
It is.
do you have questions, doctors? Okay. Yeah, there is.
Good afternoon, Dr. Xanya.
Good afternoon.
Yeah, after your presentation, I saw and it shows some basic knowledge on physiology and histology. And I guess it's working on the theory of, it's working on the ion channels, the sodium and calcium channels.
Right.
It occurred to me, does it work the same principle as in Rife therapy? Rife therapy?
It doesn't really, but the rifotherapy is a precursor of this kind of conceptual understanding of what we have. But it's very different, really. But it's within the same arena, if you like.
Yeah,
It's
because,
the same type of, the same direction, but only a much kind of later stage, because it's very, very specific, far more specific and it really deals with molecular mechanisms. You see, what fascinates me, has all fascinated me, is that you look at ATP and AMP and GMP, these guys go back and forth in time all the time, which we cannot do. So if we want anti-aging, we want time reversal, what do? We focus on molecular mechanisms. But of course, the science of today is very, very difficult. We do not observe it. So, but I think that it's going to be the science of tomorrow.
Yeah, because it's really fascinating. Just look at the pictures of the wound healing using only frequency.
Right.
So it's something working on the life therapy
That's
principle
right.
too.
That's right. That's right. What Reifel did, he basically created this frequency. He said everything has a certain frequency. So it's exactly the same concept that Dr. Ahmad was saying. If my liver has a problem, I'm going to give liver cells to it. If my brain has a problem, I'm going to give brain cells to it. It's the same concept. But here you say, okay, every organ has a frequency. So you say, okay, now this organ, the frequency is damaged, so I'm going to give it the same frequency. And it's like basically, like the example that we said about a dancer. It's like, you rub that tired kind of cell and you dance it back to its normality kind of thing.
Okay, if there are no more questions, then I guess we have to thank here our beautiful, young-looking Dr. Xanya. Can I ask all the executive officers or the board of directors to come on stage? Dr. Ellery Mendez, Dr. James Luada, Dr. Gisela, Tom Sarmiento, Dr. Richard Sarmiento, Dr. Roda Espino, Dr. Albert Taco. Can you come up?
And to award a plaque of appreciation, I'd like to call on Dr. Charlie Mendez, Dr. Francis de Cangchon, Dr. Maria Ellery Mendez, Dr. James Boado, and Dr. Gisela Sarmiento.
The Philippine Academy of Aesthetic and Age Management Medicine Incorporated awards this plaque of recognition and is presented to Ms. Xanya Sofra as a resource speaker on the topic entitled Postpartum High-Speed Virtual Exercising and Rejuvenation. So, given this third day of September 2016, during the PAAAMMI 4th Annual Convention with the theme Age Management and Aesthetic Revolution, keeping up with advances and changing trends, held at New World Manila Bay Hotel, Manila, Philippines. Signed by Dr. James Boado, Chairman, Committee on Scientific Program, Dr. Maria Ellery Mendez, Overall Chairman, Annual Convention, and Dr. Charlie Mendez, National President, Honorary Chairman. Congratulations.
Point, dear colleagues, we as a family of PAAAMMI, we are very much honored and grateful because it's the first time that Dr. Xanya Sofra has came to the Philippines. So it's her first time in the Philippines. She's an icon also for anti-aging, and she's bringing the latest technology of that Ion Magnum. Soon enough, again, very first. You heard it first here in PAAAMMI, and we'll have our scientific symposium, and also they will showcase it once again within the year, and hopefully again next year in our next convention. And with that, as gorgeous as she is at 62, we want to say today she is celebrating. She is out from her country. She's here in the Philippines to celebrate her 62nd birthday with us today.
that concludes our scientific session for today. Thank you to all the delegates and of course especially to our guest speakers. Now before we end, we would like to invite everyone tomorrow for day 2 of PAAAMMI Convention.